If you or a loved one has been told that cardiac resynchronization therapy, or CRT, might help with your heart failure, you may be wondering, what is it, why it works, how is it done, and how will it affect daily life? Clinically, CRT has been shown to help the heart's chambers beat together in better rhythm, improving how efficiently it pumps blood, easing symptoms of heart failure, and helping many people breathe easier and feel more energetic. Think of it as a way to help your heart work smarter, not harder, restoring balance so it can do its job more effectively. Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. In this episode, I'll take you through CRT implantation, from preparation to recovery, so you know what to expect and feel reassured. Let's start with what exactly CRT does and how it can help your heart work better. CRT is sometimes also called a biventricular device. It's a specialized type of device that helps the heart's chambers beat in a more coordinated way, better pump blood to the body, and reduce the workload on the heart over time. As a result, patients experience fewer symptoms. They can breathe easier, feel less tired, and have less swelling. CRT is designed for people with moderate to severe heart failure, especially when the heart's electrical system isn't working in sync. CRT uses a small device called a biventricular device to help the lower chambers of your heart, the right and left ventricles, squeeze together in a more coordinated way. Instead of stimulating from just one side, CRT uses two leads to help both sides of the heart to squeeze together, just like the way you'd squeeze a balloon with both hands to get a stronger, more even push. There are two main types of CRT devices. Cardiac resynchronization therapy with a pacemaker, or CRTP, is for people who have certain stages of heart failure and irregular heart signaling. It sends signals that make the lower heart chambers beat at the same time and help the heart fill with blood properly. Cardiac resynchronization therapy with a defibrillator, or CRTD, uses a pacemaker and an implantable cardioverter defibrillator. It may be recommended for people with heart failure who also have a risk of sudden cardiac death. It can find dangerous heart rhythms and correct them. It can pace the heartbeat or shock the heart out of a dangerous heart rhythm. CRT isn't for everyone with heart failure. It's usually recommended for patients with moderate to severe heart failure who still have symptoms despite medications. Your care team may recommend CRT if you have heart failure with abnormal electrical signaling, where one side of the heart beats slightly later than the other. It may also be suggested if you already need a pacemaker or defibrillator for another rhythm problem, since a biventricular device can provide both rhythm support and better coordination for the heart's pumping. Now, let's move on to what to expect before your CRT procedure. First, you'll meet with your care team. They'll go over your medical history in detail, including any past heart conditions, procedures, and medications. This step helps ensure the procedure is safe and tailored to your specific needs. Next, you may have some tests to confirm the diagnosis and guide the plan. These can include an EKG, which records your heart rhythm, an echocardiogram, which uses ultrasound to show the heart's structure and pumping function, or simple blood work to check your overall health before surgery. Your doctor may need to adjust some of your medications, especially blood thinners. In certain cases, you may be asked to stop them temporarily. These instructions are critical to reduce bleeding risk during the procedure. Always follow your care team's guidance closely, and remember, never stop or change medications on your own. On the day of your implant, you'll be asked to arrive fasting after midnight. This means no food or drink after bedtime. Fasting helps reduce risks with anesthesia and keeps the procedure as safe as possible. The procedure itself is usually done with local anesthesia and deep sedation. This means you'll be awake during the implantation, but very relaxed and drowsy, and you shouldn't feel pain. Let's take a closer look at what actually happens during a CRT implantation. The procedure begins with a small incision just below your collarbone, most often on the left side. This provides access to the vein that leads into your heart. Your doctor gently threads thin wires, or leads, through this vein into your heart chambers. These leads are positioned precisely using X-ray guidance, ensuring they can deliver electrical signals that keep your heart beating in a steady rhythm. Once the leads are in place, They are connected to the generator, a small device that contains a battery and computer circuitry. The generator is then tucked under the skin of your chest, usually in a small pocket created during the incision. Before finishing, your care team will perform a detailed check to make sure the leads are working correctly, the generator is functioning as programmed, and your heart is responding appropriately. Some adjustments will be made in real time to ensure accuracy. Then, we'll gently close the incision with stitches and surgical glue and place a clean, sterile dressing over it to protect the area and help it heal. From start to finish, the procedure usually takes about 2 to 4 hours, though the exact time can vary depending on your heart and any adjustments your doctor needs to make. Right after the procedure, you'll stay in the recovery area for a few hours. During this time, your heart rhythm and incision are watched closely to make sure everything is stable. Your nurses will check your CRT device site, heart rhythm, blood pressure, and oxygen levels. They'll also observe your arm movement to make sure the incision is healing properly and that you're safe to begin light activity. Most patients are able to go home the same day, though in some cases, your doctor may recommend staying overnight for additional monitoring. Before you leave, your care team will test the CRT device with a programmer to confirm that it's working correctly, and they'll take time to explain how the device functions. In the first days after surgery, your arm on the site of the implant may feel sore. To protect the leads and incision, you'll need to avoid lifting your arm above your shoulder for about 2 to 4 weeks. This gives the device and tissues time to heal securely. Once you return home after your CRT procedure, recovery is usually smooth. Here's what to expect and how to care for yourself. It's normal to have some mild bruising, swelling, or soreness around the incision site. These symptoms usually improve within a few days. Be sure to keep the incision clean and dry. You can shower, but remember to place a towel over the dressing and avoid letting water run directly on it. Leave the top dressing in place until your wound check in clinic, which typically happens 10 to 14 days after your procedure. For the first couple weeks, avoid heavy lifting, pushing, or pulling with your arms. This gives the incision sufficient time to heal securely. Walking and doing light everyday activities are not just safe, they're a good idea. Moving around helps you heal. Follow-up visits are an essential part of care. During these visits, your team will check the device leads and settings to ensure everything is working properly. This is also a good time to ask questions about your activity level, incision healing, or anything else you've noticed since the procedure. In general, people return to normal activities within a few weeks. In addition to mild bruising, swelling, or soreness near the incision, other normal recovery symptoms after CRT device implantation may include mild chest or shoulder discomfort near the implant site, especially when moving the arm on that side, temporary fatigue for the first few days as your body adjusts. Minor oozing or tenderness around the incision should improve quickly, and a small lump or bump where the device generator sits under the skin. These issues are usually mild and short-lived. But if you notice severe pain, fever, worsening redness or swelling, drainage, or dizziness, these are not normal and you should seek medical help right away. Now, let's talk about what life looks like once you're living with a CRT device. Research has shown that CRT devices are reliable. On average, the battery lasts between 7 and 12 years. When it runs low, the generator, not the leads, will be replaced in a minor outpatient procedure. You'll receive a CRT ID card that lists the type of device you have, the manufacturer, and other important details. It's a good idea to keep this card with you at all times in your wallet or on your phone so healthcare providers can access the information if you ever need medical care. The good news is that most household electronics are completely safe. Things like microwaves, cell phones, and home appliances won't interfere with your CRT device. But you'll need to be cautious around strong magnets, like those found in large speakers or industrial equipment, and certain security systems, such as metal detectors or anti-theft gates in stores. If you're ever unsure, simply show your ID card and ask to walk around rather than through the system. Once you're healed, you can return to exercise, travel, and your normal activities. Many people forget they even have a CRT after the first few months. The device is there to support your heart rhythm not limit your lifestyle. Even though most patients recover smoothly, it's important to know the warning signs that need immediate medical attention. If you develop severe chest pain or sudden shortness of breath, call your doctor right away or go to the emergency room. These could signal a heart-related complication. If you experience dizziness, fainting, or a return of very slow heartbeats, your device may not be functioning properly and needs urgent evaluation. If you ever notice new abdominal twitching or persistent hiccups after your CRT procedure, contact your care team or device clinic. It can sometimes mean one of the wires is stimulating the breathing nerve, and the team can adjust your device to correct it. Keep an eye on your incision. If you see more redness, swelling, warmth, or drainage, it could be a sign of infection and needs quick care. A fever or unexplained chills can also signal infection either at the incision or in your bloodstream and should never be ignored. These problems don't happen often, but if they do, get help right away. When in doubt, call your doctor or go to the emergency room. It's always better to be safe. Now, let's talk about what to expect as you return to your normal life after CRT device implantation. Recovery usually begins quickly. Within the first 24 hours, most patients can walk, eat normally, and take care of light chores. By about 1 week, many are able to return to desk work and their regular daily routines. That said, it's very important to protect the healing incision and leads. For the first 2 to 4 weeks, avoid heavy lifting, pushing, or pulling with your arms. Walking and light daily activity, on the other hand, are safe and encouraged. They help your recovery. You may be prescribed short-term antibiotics or pain relievers to help with incision care. Some patients also continue or adjust their blood thinners depending on their individual health needs. Always follow your doctor's guidance and never change medications on your own. Your CRT device will be checked in the clinic within 1 to 2 weeks to confirm that the leads are stable and the device is working properly. After that, regular follow-up visits are essential. These visits allow your care team to fine-tune the device settings and ensure your heart rhythm remains well supported. So that's cardiac resynchronization therapy, or CRT, in a nutshell. Careful preparation with imaging and medication review, a safe 2 to 4 hour procedure to place the leads and biventricular device, a short recovery that's often same day or overnight, and follow-up visits within the first 2 weeks to check healing, lead stability, and device settings. CRT helps the heart's chambers beat together in a better rhythm, improving blood flow, easing symptoms like fatigue and shortness of breath, and helping you return to daily life with more energy and confidence. If you found this guide helpful, please share it with loved ones who may be preparing for a CRT procedure. And don't forget, you can find a patient-friendly pocket guide linked in the episode notes. Thank you for listening to the Pulse Report. I'm Dr. Shen, and let's keep your heart and your life going strong and in rhythm.